Hey everyone, this is Hannah with the Rocket Miner. Today I have some updates on where we're at with COVID-19 as a state and as a county, and wanted to give some encouragement as it is Giving Tuesday today. But I wanted to start off with some of the COVID updates and the news on that. To go over some of the numbers, today we had 336 new confirmed cases reported since yesterday. Today we're also at 7,572 active cases. This is actually down by 1,040 from where we were at yesterday. And that is the fifth time in 6 days that the number of people who are sick with COVID actually went down for Wyoming, which is great that we are starting to see the active cases go down and the confirmed cases not be as drastic of increases each day. We've been doing pretty good over the past few days with actually seeing that start to decline a little bit. Thinking about that and the numbers and what that means and where we're at, I just want to remind everyone to keep in mind all the different factors that influence things, and just also the perspective that the numbers that we see right now are really the result of actions that people did a few weeks ago. So because you have that 2-week time period for people to get sick and to develop the virus, as I said, the numbers we see now are not really reflecting what people are doing right now, but reflecting what people did in that 2 to 3 week ago range. So I think that's great, as I said, that we're seeing it go down. I am still concerned that we are going to see it go back up again as we start to see results from Thanksgiving. I think that the spikes we saw at the beginning of November were a result of things like Halloween and spikes that we saw coming from actions that people took during that time frame. And so I think now, seeing things go down, obviously there are so many things that influence this and lots of factors that are a part of it. But I've just been thinking that over the past couple of weeks, we've seen things like more mask mandates going into effect. We've started seeing actions like that, and I'm hoping that that's where this decrease is coming from. I'm hoping that actions like that will continue to help. But I am concerned that we will see it go back up again as we see results from Thanksgiving, and but that's, time will tell what people have done and the effects that it's had and where that will be. But as I said, for now the cases have been going down, which is encouraging. Unfortunately, one of the numbers that did go up again was the death total. Today we reached 230 total deaths, and we hit that number with 15 new deaths that were reported today. Today the Wyoming Department of Health released a lot of information about the deaths that we've been seeing in Wyoming from COVID. We had 38 deaths that had been reported in the death total number between November 21st and 25th, but the details on those specifics, where they were, the age range, just the details that are usually released about those deaths had not been specifically released yet. And those were released today by the Wyoming Department of Health, and as I said, that was 38 deaths. And then there were the 15 additional deaths that were also reported and had the details released on those today, which was a total of 53 deaths that we have the details on now. You can go to rocketminer.com to read through all of those details. As I said, they say what county, they say whether it's male or female, give an approximate age range. They usually either just say adult or older adult. They say whether or not the person was known to have pre-existing health conditions that put them more at risk. So you can go and read those details. As I was looking through those today, though, I just thought, I was sitting there scrolling through that list of details, and it was incredible in the worst way, in the fact that it was just unbelievable to sit there and scroll through that many names, well, not names because the names aren't given, but that many details of specifics of individual people who have died from COVID, and to think that even though I don't know their names, these are individual people, these are family members that people have lost just before the holidays, and that is just, our hearts go out to them for the people who are feeling and experiencing that loss. And it is as I said, just incredible that we have reached this height of deaths in Wyoming, and especially within the last month that we have seen so many reported. So with that, just always a sobering reminder to me of how serious this virus is and the effects that it has and how it can change people's lives. And I hope that people keep that in mind when they see those numbers and those statistics, that these are people, this is Wyoming, these are our people and our community. Today also for Sweetwater County, we got an update on some of where we're at with COVID and what's happening, what some of the concerns are. Today, local health officials had a Zoom meeting where they met with other local leaders and officials to give an update on where we're at with COVID, how our hospital's doing, and everything related to that. Our county health officer, Jean Station, kind of led the meeting, but there were several doctors who spoke and others who gave updates. Some of the doctors who shared updates from the hospital and from Castle Rock Medical Center were Dr. Melinda Poyer, Dr. Brianne Crofts, and Dr. Connie Fauntleroy. And then Trista Cross with Sweetwater County Public Health also gave an update. And Dr. Station also shared some information that was coming from Dr. Celeste Karn. We do have a story about that meeting that has more details about some of the things they discussed that will be up on rocketmeyer.com, and it will be in the paper. But I wanted to go over a few points that they made in that meeting, some of the updates that they gave, and things that I thought stood out and were important. Dr. Station noted that 1 month ago, Sweetwater County was ranked 22nd out of 23 counties in Wyoming for COVID cases, and now we're ranked 3rd. There are only 2 other counties who had more cases than us in the last 2 weeks. And that was Laramie County, which includes Cheyenne, and Natrona County, which includes Casper. So obviously for us to go from being 22nd to being 3rd is not a good thing. It shows the increases that we've been seeing here in our county and just how serious and how drastic those have been. Currently, as of today, we have 6 people who are in the ICU, including 1 who is on a ventilator. Also, they gave updates on just the fact that our active cases and our positivity rates just continue to go up and to remain high. Discussing things, Dr. Station did note that COVID is not similar to the flu. A lot of people make that argument. Obviously, she's been hearing that argument as well. But she pointed out that the flu kills an average of 12 people a year in Wyoming, and we have now had 230 deaths from COVID. So clearly in the death rates, people like to argue, well, people die from the flu too, COVID is similar to the flu. It's not. Obviously many more people have died from it, and it's just a much more serious virus. One of the main points of the meeting today was just this concept that the concern right now is our hospitals being overwhelmed, not even necessarily in the equipment or the space, but especially, most importantly, in the staff and the people, the healthcare providers, those who work at the hospitals, just being overwhelmed, not having enough staff to take care of the people that they have, and then the staff that is there and is working so hard just getting burnt out. They noted that ICU nurses right now have been working 12-hour shifts, only getting 1 day off. They said that hospital staff are not used to dealing with this many deaths. We've had 10 deaths from COVID in Sweetwater County, most of those in the past month. They said that the physical and emotional tolls on all of our healthcare providers are so high right now. And if the numbers keep going at the rate they are, if we don't slow things down, then we will be overwhelmed on every level, especially in our hospitals and healthcare providers. They also noted concern about the holidays, about seeing a spike coming from Thanksgiving and then again after Christmas. They also said that they are still doing the best they can with testing and contact tracing, but Those are both being stretched thin right now, and lots of times they're several days behind on getting test results or contacting people, and that is again just because of how overwhelmed they are and how high the numbers are and how stretched thin all the staff that's working on that is right now. So the main concept of the meeting that all the doctors discussed was that things are out of control right now in Sweetwater County, and we do need to get them back in control to bring the numbers down, and that will only happen if everyone in our community takes personal responsibility. Dr. Station said, "We don't have it under control here, and I have real concerns for where we're headed." They noted that it is just important that everyone needs to take this seriously, needs to realize where things are at, and take precautions, take the actions that we've all been told we need to do in order to help limit the spread so that we can get those numbers back in control. Dr. Station noted at the end of the meeting that they're expecting new state health orders coming from the governor soon. She's expecting to have more restrictions on gathering sizes and details like that. For Sweetwater County and our mask mandate that extended to December 4th, she is working on getting a re-up of that mandate that will include a few changes to a couple details, but if that is approved, that will then extend for another month to go until January 4th. When Dr. Fauntleroy was talking during the meeting, she said that she was hoping we can change the conversation in our community from being one of arguing about COVID and arguing about masks, and to instead of arguing, to be a conversation about how can we support people, how can we support everyone who's affected by this, how can we care for each other during this hard time and do our best to be a loving and caring and supportive community. And I think that that's important, just to change our mindset and our frame of reference and how we're talking about this, to be who needs help right now and how can we help them. On that note, also just of how we can be a supportive community that extends to so many areas of life. And as I said, today is Giving Tuesday. This is a day that is set aside. You have Black Friday and Cyber Monday and all these things that are focused on buying, and Giving Tuesday was set aside then as a day to pay it forward and to give back to nonprofits and charities and to help these organizations that help support our communities. Here in Sweetwater County, we have over 300 nonprofits. And I know that nonprofits have been hit especially hard this year with COVID, with the effects on the economy, with just being short-staffed. Nonprofits rely so much on donations and on volunteers, and those have been in short supply this year for so many reasons. I know it's been a very hard year for them, and they need support right now especially. We have so many great nonprofits here in our community. Just a few examples: you have the Food Bank, the YWCA, the Humane Society, the Ray Lovato Recycling Center, Actors Mission, the Boys and Girls Club, Young at Heart, Hospice of Sweetwater County. There are so many groups. That's just a couple of them. And something I think is cool about Giving Tuesday is you can pick a cause that you're passionate about, something that you care about, and give to support it. If you love theater like I do, you can give to Actors Mission that produces local theater for us here. If you love animals, you can give to the Humane Society and support them. If you care about the environment, you can give to the Recycling Center. If you've had a loved one who's been helped by hospice and the work that they do, you can support them. There's so many options and so many good organizations to give to that do so much to help our community. So I think today is an awesome day to specifically give and to support them. But just with this whole concept, with everything from things like Giving Tuesday to COVID and our response to it, we have a great community here, And it's awesome to see our community come together and support each other and help each other through hard times. And that needs to continually be our mindset and the way we think of what has this community done for me, and then how can I pay it forward? How have I been supported, and how can I use that to help support other people? If you see a need, you can act to help meet that need. And I just think that's the best mindset that we can have right now, going forward into the holidays especially, is one of generosity and giving and caring and thinking, how can we support each other? How can we strengthen and help our community? Thank you for listening. Keep checking with us for more news and updates, and I hope that everyone has a good night.